My name is Alyssa and I'm a PICU nurse. I've been a PICU nurse for 6 years, but I've been a pediatric critical care nurse for 8 years. I became a nurse practitioner for future job security and flexibility. Right now I do enjoy still working at the bedside, but I know that later on in life, when I have kids, I'll want to work better hours and maybe in a more relaxed setting than being a bedside nurse in the ICU. One thing that led me to think, maybe I could be a nurse practitioner is after I had so many years of nursing experience, there was so many times where I would think in my head, I don't think that's right for my patient, and I wanted to make the decisions for that patient. So as a nurse practitioner, I'll be able to do that and make the whole plan for my patients and make sure everything is how I think it should be. There's tons of options for NPs. You could work in an outpatient specialty clinic. For example, I like pediatrics, and during my clinical rotations, I rotated around the hospital. I really liked the medical floor, and then I also rotated around the outpatient clinic. So all the kids, before they would go into the hospital for their cardiac surgeries, we were kind of working with them outpatient to make sure they were ready for surgery. You could also be a teacher. There's just so much you could do. Or work at a family clinic or an urgent care. There's a lot of different NP specialties. At my school, I went to University of San Diego. There was emergency, geriatric, family, psych, mental health, and pediatric. I did a dual program, so I am a family and a pediatric nurse practitioner, and I got my doctorate. I was between getting a master's and a doctorate. The master's program was 2 years, and you still have the same privileges to function as a nurse practitioner if you get your master's, but the doctorate was 3 years. And I figured, I'm already in school, I might as well get my doctorate now rather than do 2 years for my master's, finish school, and then decide I want my doctorate and then have to do an additional 2 years to get my doctorate. A while back, the Board of Nursing was going to require that you needed a doctorate to be a nurse practitioner. They haven't really brought that up recently that I know of, but just in case in the future, I wanted to have it in case that became a requirement. Prerequisites are your bachelor's in nursing, and that's pretty much it. I think that some schools require a statistics course within a certain amount of time, but I graduated college in 2013, and when I started grad school in 2019, all of my requirements were still valid from my undergraduate program, so that was good. And then it took me 3 years, and it was kind of full all the way through. We never had off in the summer, so it was an intensive course. I worked in the beginning during the first year of grad school, and after that, I was starting my clinical rotations, so then I switched to pediatric PACU because it was easier to be on day shift, and I did part-time twice a week. But then my last year of school, it just became too much with clinicals, so I went per diem. So I only worked 2 times a month and then did school, but I do know a lot of people that worked full-time and went to school full-time. Personally, for me, I would rather be in debt and have sanity than spread myself too thin. So as a nurse practitioner, you could have better hours. Typically if you work inpatient as a nurse practitioner, you'll still be doing 12-hour shifts, but you could also work outpatient and have a nice 8 to 5 Monday through Friday job. I think that nurse practitioners do end up taking more home with them. Even if you're off the clock, you'll still be following up with patients and kind of taking more home with you than as if you were an RN, but definitely more opportunity to have regular hours. I know that there are many states, I forget the number, that have full practice authority for nurse practitioners, meaning you could operate without the supervision of a doctor. California passed a bill, I think in 2020, that nurse practitioners will have full practice authority in January 2023. I'm not so sure though that I like that bill because I think nurse practitioners should work with a doctor. I mean, we're all part of a team, right? And I think that doctors have things that they're good at, and then nurse practitioners have things that they're good at as well. So I think we should all work cohesively as a team, and hopefully the bill will help nurse practitioners help out in rural areas where there's really no health care at all. But I hope we don't lose sight of working as a team with physicians. But we are allowed to prescribe and treat patients. From my experience in my clinical rotations, the nurse practitioners that I was with, they all had really good relationships with the doctors they worked with. Each institution has standardized procedures. So it's basically a list at that facility what that nurse practitioner is allowed to do to make sure they're doing it safely. The amount of oversight the physician gives you, it just depends on the doctor. Some of them basically would round with us. We would tell them what was going on with the patients, and we wouldn't see them for the rest of the day because they have a good relationship with that nurse practitioner. They're gonna let her make all the decisions for that day, and she can just contact them if she has a question. Others would more so kind of guide the patient's care a little bit more firmly than other physicians. I really think you need bedside experience to be a nurse practitioner. You need those critical thinking skills and just really understanding what it is to be a nurse before you can move on to that next level and safely practice as a nurse practitioner. So I haven't really looked for a nurse practitioner job yet, but I have heard that my starting salary will be much lower than what I'm making as a registered nurse. So, especially with the travel nursing right now, the money is just better as a registered nurse. I'm sure that once I get my first NP job and kind of work my way up, I will get better pay, but there's also, most nurse practitioner jobs are salary instead of hourly. So even if you're staying late as a nurse practitioner, you're not getting paid overtime. I feel like it's a touchy topic with the PA versus NP. I just like the team feeling at the hospital. Like, I don't care if you're the attending physician, you're the nurse practitioner, or the PA, or the registered nurse. Everybody's working for the same thing, which is the patient, and everyone's a team. So whenever there's talk about different titles or who has full practice authority and who doesn't, I think we just need to focus on doing what is best for our patients. For RNs wishing to transition into being an NP, just make sure you get that bedside experience. You don't really need to know what you want to do with the NP, because I have been graduated for a year and I'm just happy that I have the degree, and I'm still kind of figuring out what I want to do with it. But if you're feeling the itch to get into school now, go for it. Just make sure you get your bedside experience before you jump into an NP job.